Most people in the United States live in areas where those who are healthy do not need to wear masks indoors, according to new U.S. Centers for Disease Control and Prevention guidance, a sweeping change from what earlier COVID-19 metrics recommended. New CDC metrics indicate that about 28% of people in the United States live in a county where they need to wear masks indoors. Previously, CDC pointed to levels of coronavirus transmission within communities as a key metric for restrictions and recommended that people in areas with high or substantial levels of transmission, about 99% of the population, should wear masks indoors. Now, the CDC's COVID-19 community-level metrics are based on 3 pieces of data in a community: new COVID-19 hospitalizations, hospital capacity and new COVID-19 cases. The CDC's website includes a list of U.S. counties and their current COVID-19 levels. Under the updated guidance, more than 70% of the U.S. population is in a location with low or medium COVID-19 community levels. For those areas, there is no recommendation for indoor masking unless you are at potential increased risk for COVID-19, and if so, the CDC recommends to talk to your healthcare provider about wearing a mask. We're in a better place today than we were 6 months ago, 6 weeks ago, 6 days ago. Now it's time to focus on severity, not just cases, of COVID. Because of all the hard work that's been done and the many tools we've developed to tackle COVID, we can ease the guidance on mask use. Not everyone in every place needs to wear a mask. At all levels, the CDC recommends people get vaccinated and boosted, and get tested if they have symptoms. In areas with high levels, the CDC also advises wearing a mask in public indoor settings, including schools. In areas with medium levels, the CDC advises talking with your doctor about wearing a mask if you're at increased risk for COVID-19. In areas with low COVID-19 community levels, there is no recommendation for mask wearing. The CDC notes that anyone who wants to wear a mask should continue to do so. The updated CDC recommendations reflect a new approach for monitoring COVID-19 in communities, Dr. Gerald Harmon, president of the American Medical Association, said in a statement Friday. But even as some jurisdictions lift masking requirements, we must grapple with the fact that millions of people. In light of those facts, I personally will continue to wear a mask in most indoor public settings, and I urge all Americans to consider doing the same, especially in places like pharmacies, grocery stores, on public transportation, locations all of us, regardless of vaccination status or risk factor.